Hello, this is Dr. Mercola, and today I'd like to talk to you about arthritis. This is a condition that you know that affects tens of millions of people, and it can be quite disabling and crippling. And there are basically two different types of arthritis. One is called osteo or degenerative arthritis that you typically acquire as you get older, and the second is rheumatoid arthritis, which is actually an autoimmune disease. And to discuss more of those, I've actually created a separate video which is below this one, so if you're interested in the differences, then certainly watch and review that video. But what I want to go review in this video is really a treatment protocol and a plan to treat rheumatoid arthritis, which is by far the more serious condition. And rheumatoid arthritis would include not only rheumatoid, but also other rheumatoid-like conditions such as lupus or SLE, ankylosing spondylitis, polymyositis, dermatomyositis. These are, and scleroderma. These are some of the other types of conditions that would be categorized in the umbrella of rheumatoid arthritis. And traditionally, patients with these types of illnesses are seen by the specialist of specialty called rheumatology. And as many of you know, I'm not a great proponent of conventional medicine, but nearly every single specialty I can think of has some valid appropriate use, and some more than others, such as surgeons or emergency room physicians. And thank God we have them. They really have a very powerful and effective tool and skill that can really address some major challenges that we have, primarily from acute traumas and such. But one of the disciplines, and perhaps really the only one that I don't believe actually even needs to exist, is rheumatology. Other than really diagnosing patients, which is an important component, but other than the diagnosis, they really have, in my experience, virtually no benefit for patients because they really rely on toxic approaches that primarily just treat the symptoms. And the remedies and therapies and drugs that they're using are some of the most toxic in medicine. About the only other specialty that uses more toxic medications would be oncology to treat patients with cancer. And even in rheumatology, they use some anti-cancer treatments such as methotrexate. So I really, don't believe that, for the most part, once you understand these principles I'm going to review, that a rheumatologist is an appropriate part of the regimen. Certainly, using them carefully and weaning yourself off of the drugs that are typically prescribed is the biggest challenge. And really, when well, let me just state that there are alternative views. And I first became interested in the alternative views of treating rheumatoid arthritis when I saw a 2020 segment in 1989 that interviewed Dr. Thomas McPherson Brown, who at that time was really close to the end of his life, and I hadn't realized it, but he had been treating for 5 decades or so patients with rheumatoid arthritis and rheumatoid-like conditions. And Dr. Brown was a board-certified rheumatologist. He was actually a graduate of Johns Hopkins University, and really was a pioneer. And he vigorously objected to the primary treatments that were being done in those days, and that primarily relies on the use of prednisone. Now, his theory was that rheumatoid arthritis was actually an infectious disease caused by a mycoplasma, or an L form of bacteria. So he essentially used antibiotics to treat patients. And he had, over his years, treated over 10,000 patients, and most of them have gotten tremendously improved. And I was just at the beginning of my journey in treating patients with health, and had adopted it and started treating patients with this protocol, and was actually quite surprised to see quite dramatic improvement in most of the ones that I was taking care of. And I used this approach for nearly 20 years, and over those 20 years, Dr. Brown did die in 1989, and so he wasn't able to contribute any further to the therapy, but there was a number of us who treated it, and I myself wound up treating about 3,000 patients, and I think probably collectively there's been over 100,000 people who've tried this. So it has been used by many people. This is not a new experimental innovative therapy. It's been around for quite some time, and there's actually quite a bit of peer-reviewed, double-blinded, placebo-controlled trials that document its effectiveness. However, most of the trials tend to focus on the use of an antibiotic. And what I learned early on is that although Dr. Brown had really a very powerful and innovative way to attack this disease that was strategically far more foundationally effective than using immune-suppressing drugs, it still needed a lot of tweaking. And one of the side effects of this approach is that most everyone underwent a reaction called the Herxheimer reaction. And that is a scenario where your symptoms actually worsen once you start the treatment. And that worsening could be anywhere from several weeks, but typically several months to even longer. And then people started to notice an improvement to the point where they would gradually go into remission. And these conditions and these symptoms that people had are really quite amazing. And many of you have probably seen someone with rheumatoid arthritis. There's typically joint deformities, and that's one of the ways that you diagnose it. It's very difficult to have the diagnosis of rheumatoid if the hands aren't involved. And typically there's you can see by these pictures some of the amazing changes that occur actually within the joints. And unfortunately, when you are receiving treatment for this, the treatment that I'm describing, although it's effective at stopping the progress of the disease, it will not, and let me emphasize, it will not reverse the joint deformities that have already occurred. So the best that we can hope to do is stop the disease in its tracks and prevent any further deterioration. But most of the time the pain is so severe in these conditions that that's a quite dramatic benefit for nearly everyone, because the pain is so crippling, disabling, they're nearly suicidal in many cases. So it's a major benefit. So anyway, Dr. Brown had used this approach. It involved the Herxheimer reaction. And as I gradually started adopting it into my own practice, I realized that there were ways to improve it. And interestingly, when I started using this, it was at the beginning of my medical practice, and over the years, my modifications and revision of the protocol paralleled my adoptions of new information I was learning on how to optimize people's health. And there were a number of different strategies that I learned over the time that made some quite dramatic benefits. They typically occurred in the mid to late 90s, and some of the major ones were nutritional typing. In other words, the concept that we are not all designed to eat the same foods. That a food that would cause one person to thrive and grow and do extremely well would and benefit tremendously would cause another person to actually flounder in their health. So we basically divide people into three types: a protein type, a carb type, and a mixed type. And if you're interested in this program, we actually, for many years, have had the nutritional typing test that we charge people for. Actually, tens of thousands of people took this test and we had paid for it. But we've actually recovered our cost to produce this, and we're now providing this test for free of charge. So if you're interested in that, I would definitely encourage you to use that as a tool to help you understand some of the basic foundations of what fuel you are designed to eat. So it's not only useful for rheumatoid arthritis, but it's pretty much any clinical condition. And as an extension of that, I developed a nutritional plan which is continually evolving over time, and I'll have a link to that plan on this lower on the page. And that plan is also on the right side of my home page. There's a link to it. And that's a 40 to 50 page document that really goes into all the specific details of how to optimize your diet in addition to the nutritional typing. So, basically understanding the foods that you need to eat is really an important central component of the improvement. And when I did this, when I integrated that into the program, we noticed a tremendous improvement in the way people were responding. But some of the other really crucial components that we added were things like omega-3 fatty acids. And by omega-3, I'm talking about animal-based, such as EPA and DHA, which are really profoundly important at changing some of the important elements of inflammation, because these fatty acids will actually modulate inflammation through prostaglandins. And when I first started out, I was recommending fish oil because it was my impression and understanding that that was really the best way to get that, because even back then we knew that most of the fish in the sea were contaminated with mercury and dioxins. So when you certainly don't want these in your contaminants in your food. So fish oil, at my understanding at that time, was one way to provide a clean product. But since then, I've learned there's even better ways to receive the benefits of omega-3 fats. You see, and let me just explain this briefly because I think it's an important point. What I didn't understand when I first started recommending fish oils is that fish oil has the fatty acids EPA and DHA, but these don't exist as free-floating fats. They are actually attached to a triglyceride molecule, and tri means three, of course. So it's a glyceride molecule with three fats attached to it, and the fats could be EPA or DHA or other fats, but primarily those two. And your body cannot absorb those fats in that form. It's impossible to absorb that. So when you swallow fish oil, your body has to physically break that down. It has to remove that attachment from those fatty acids to the triglyceride molecule. So that's only the first step. And because of that first step, about 80%, somewhere between 80 and 90% of the actual fish oil is not used. And much of it winds up in your gut. And that's what causes about 50% of people not to be able to tolerate fish oils, because they have this burp back, this belching with the fish oil, because that's the undigested fats in your gut that do not get absorbed. So even once you break it down and the fats actually get into your bloodstream, then they're free floating, and they don't work in that format. They actually cause some harm, and you have to break them down. And they are broken down, but the only way that you can use it is if these fats, the DHA and EPA, float in your blood to your liver, where your liver attaches a phosphate to it, typically a phosphatidylcholine or serine, but typically phosphatidylcholine. And in that form, when the DHA and EPA is attached to that phosphate, then finally your body can use it. So you're literally getting a really small fraction of the fish oil that you're swallowing. But interestingly, I found out that krill oil already has the phosphate attached to it. So all of the DHA and EPA is attached in the way that your body's physically going to use it. So it works much, much better. You need far lower doses. In fact, our typical dose of recommendation is somewhere between, typically 1,000 milligrams. But we're carefully examining the new literature that suggests maybe only 500 milligrams is all that you need. Sometimes it can be combined with GLA, gamma-linolenic acid, to provide some other powerful anti-inflammatory effects. So definitely doing that. And the other component that really is an important element of the fish oil versus krill is that the krill oil has a powerful antioxidant called astaxanthin, because these DHA and EPA fatty acids are highly perishable to oxidation. They can go rancid real quickly. And in fish oil, that's exactly what happens. It's been our experience in review the literature that most of the fish oils out there are rancid even before you open up the bottle. So the krill has this astaxanthin, which is a powerful antioxidant that prevents the oxidation from occurring. And in addition to that, what some of the newest research is finding is that this astaxanthin can be actually extracted from algae and taken as a supplement in doses of about 4 milligrams, and that may have a very powerful benefit at further reducing much of the inflammation that occurs in these inflammatory types of conditions, and may have other benefits, such as actually radically decreasing the likelihood of developing cataracts or age-related macular degeneration, which is the most common form of blindness in people. And after you've been on it for a few weeks, it actually almost prevents the ability to get sunburned. So lots of good benefits. It's actually a supplement I take every day, and one that we hope to provide at some point in the future for people. So that's another component. The other thing is that we learned is that emotional components. You know, almost all autoimmune diseases, rheumatoid arthritis, Crohn's disease, inflammatory bowel disease, multiple sclerosis, they have at their core a dysfunction in the immune system. The body's beaten up on itself. And we believe that the trigger for that dysfunction may rely in an event, an emotional trauma that occurred before the age of 5 or 6 when the conscious mind was being formed. And if you can go in there with effective tools to obliterate that pattern, then that assault on the immune system can diminish, and then healing can occur. So it's been our experience that almost every case this is present. And in addition to that, what is pervasive in the population, but clearly in people with autoimmune disease, is a vitamin D deficiency. So ideally, our vitamin D levels should be about over 50 at a minimum, and I think probably optimal healthy might be even closer to 80 or 90 nanograms per milliliter of vitamin D in your blood. So when you get your levels up to that level, that'll have a powerful influence at increasing your body's ability to fight infection. And I do believe Dr. Brown was right that rheumatoid type diseases ultimately involve the dysfunction of the immune system, autoimmune process, but there's an infectious component. So if you can use vitamin D to upregulate your immune system, to have your body optimize the production of 200 to 300 antimicrobial peptides that are far more powerful than most of the antibiotics, then you have a great chance at defeating this. So I believe so strongly that it's almost criminally, I believe it's criminally negligent malpractice to treat someone with rheumatoid arthritis and not regularly monitor their vitamin D levels, the vitamin D 25-hydroxy levels, to make sure that they're at these levels. And I would take whatever it takes, at least 5,000 units for an adult, and you have to go up to 10,000, 20,000, even 30 or 40,000 units, but to be monitored very carefully to make sure that levels get into therapeutic range. And ideally, of course, you would be able to get this from the sun. I personally am able to get my levels up to 90 without any oral vitamin D, but most people don't have the opportunity to expose their skin to that much sun. So the other component is exercise. And it's a bit complicated with rheumatoid arthritis because many times the joint deformities are such and the pain that it's difficult to participate in exercise. But really, it's going to be a foundational element of that. So one of the keys I've learned with exercise with rheumatoid is that if you have pain longer than an hour or 2 hours after the exercise in the joints, then it probably was too much damage to the joints and you have to modify it at some point in the future. But ideally you want to adopt a program, something like the peak exercise fitness program that we've been talking about really, and even if you can, the peak 8, which is a high intensity element that causes you to go to really high levels of exercise for about 30 seconds and then go into a recovery phase and repeat that about 8 times to the point where you're really pushing yourself to the maximum heart rate to have massive improvements in growth hormone and decreases in your body's percentage of body fat and really improving of your overall health. So these are some powerful improvements that I've noted, and that when we applied these, we were actually able to eliminate the Herxheimer reaction in most every one of these patients with rheumatoid arthritis. And as I said, I treated about 3,000 patients with this protocol, and about 15% or so were lost to follow-up for whatever reason. But our experience is well over 2/3, probably closer to 80% or more of the people received pretty dramatic improvement with this. So, you know, the typical strategies that conventional medicine is going to offer for you for this debilitating, devastating disease are pretty limited. They may be able to provide pain relief, but that's about it. So if you or someone you know or love has this condition, I would encourage you to carefully review the detailed update that I did below. The last time I did this update was about 10 years ago, so I modified it and really carefully edited the recommendations to provide the best the current thinking of how to improve this devastating disease. But really the key is to find a clinician to work with, an educated healthcare professional who can help you wean off these toxic medications, because it's very, very rare for someone to come in with rheumatoid arthritis who's not taking loads of devastating drugs. It's some of the most toxic drugs that you know, are used in medicine. So they cannot be stopped blindly. They need to be done with someone who understands how to use these medications. So ideally it's going to be a licensed physician who is trained in pharmacology, who knows how to wean people off of those appropriately. So I mean, there are other great clinicians who can help you, but you have to be really careful with those medications and really want to do that wisely so that you don't go into a big flare-up. So hopefully this is useful information, because this is such a devastating disease that we really need some powerful and effective strategies to address this really serious illness.